Now we have Lisa Morin with us as our subject matter expert on promoting interoperability. Lisa is a quality program consultant for Mingle. She has 20 years or more in healthcare, a lot of that time in quality reporting, risk management, quality and performance improvement. Welcome, Lisa.
Thank you, Dr. Mingle. It's nice to be with you today.
Good. I've got a couple questions about promoting interoperability. Uh, the Cures update to EHR requirements has been around since 2015. I understand that's finally being uh, going to be felt at the user level this year. Can you tell me about that?
Sure. So the 2015 Cures update is something that healthcare EHR systems have been having in the works and actually should have updated by December 31st of 2022. So that means for the 2023 reporting period, your vendor should have updated your system, and you need to make sure that that has happened and also that you're using the functionality within that Cures update within or by the start of your reporting period in 2023. So if you have any questions about that, you certainly want to check in with your vendor about that updates and make sure you have everything in place that you need.
Thanks, Lisa. That's a good warning. Uh, and are there any changes in who needs to report promoting interoperability in 2023?
Yes, for many years now, CMS has automatically reweighted a number of different clinician types. So they are continuing with reweighting for some clinician types, but they're discontinuing that automatic reweighting for four specific types. So if you or your group has providers included that are nurse practitioners, physician assistants, certified registered nurse anesthetists, or certified nurse specialist, those providers do need to report in 2023 as part of your group, or if they're reporting individually, they need to report promoting interoperability. Um, Keep in mind that the small practice exemption still applies. So you could qualify for automatic reweighting for small practice status or hospital PACE status or non patient facing status. So that might apply in certain circumstances.
Can these users, Lisa, make application to be reweighted?
There might be a specific reason for reweighting in the promoting interoperability category. CMS will continue to offer the hardship application in the promoting interoperability category. So if you have a reason that you don't necessarily qualify for automatic reweighting, but you feel you have a reason why a justifiable reason for not reporting promoting interoperability, that would be a reason to reach out to your consultant and see if you qualify, and your consultant can help guide you through that process.
What other changes are we seeing in the promoting interoperability category for 2023?
So, CMS has made changes to a couple of existing objectives and measures, and also there's a new measure in place for 2023. So, under the Public Health and Clinical Data Exchange objective, they are changing the levels of engagement for those registries that you've traditionally reported on. In the past, you could get credit if you were in one of three levels of active engagement. So for 2023, what CMS is doing is they're combining the historic option one and two into pre production and validation. That used to be either you were registered waiting for the registry to respond, or you were testing and starting to get that registry link going. They have the third option used to be, are you actively sending and or receiving information? What they're doing is they're calling that the validated data production level. Um, so there's no changes in being able to say that you're in active engagement, you just have to, starting in 2023, you have to identify whether you're in the pre-production and validation phase for the registries you report on, or say that you're validated data in the validated data production phase. You start to report on that in 2023, and then starting in 2024, you can only be in the pre production and validation phase for 1 calendar year. So that means that if you've been in a registry that you are still waiting to be up and running, um, starting with 2024, you may need to review that further to see whether that's a registry you can continue to report on. Um, we still have the 5 different registries you can report, 2 of those being required, and the 3 others being optional for bonus points. So I think it's most important to hone in on those 2 required registries to make sure that you are going to be able to continue to report effectively on those 2 registries. And of course, the bonus, you can continue to get bonus points if you're able to. Once again, any questions, talk to your quality program consultant, because sometimes that gets a little bit difficult to kind of sort through, and we're here to help you with that. As far as other measures, we have the query of the PDMP, which has been a bonus measure. That is now required. It is still only a yes or a no. So I think for most folks, it's still going to be something that's fairly easy for them to uh, report on. CMS has also added a new exclusion for that. Um, if the querying the PDMP would impose an excessive workflow or cost burden, they allow you to be excluded from that. Having talked to a lot of my clients, seems like that's something that folks are doing if they are prescribing the medications that are included. The CMS has also added another element to this measure. They've added, in the past, it has been that you had to query Schedule 2 medications. They've added Schedule 3 and Schedule 4. They're not doing that to add another burden to practices. Rather, they've added that so that if you've got a process in place where you're checking or querying for Schedule 2, Schedule 3, and Schedule 4, you don't have to do anything different. They've added that in so you can get credit for any one of those 4 types. They're not mandating that. They've also identified that there's an RX check resource for free. So we have heard from some folks that this has been a difficult thing, or could be a costly thing to implement. So CMS is adding that or reminding folks about that. Um, there is a new health information exchange measure. So, this is an alternative we continue to have in the health information exchange objective. We have support electronic referral loops by receiving and incorporating, reconciling health information. We have the um, sending health information, or you could report on the health information exchange bidirectional exchange measure. Or, new for 2023, you can say that you are participating in the Trusted Exchange Framework and Common Agreement program, also often noted as TECFA. We love our initials here in healthcare. So this isn't anything that you have to do above and beyond, but if this is something that you're involved in, you can get credit for that particular measure and for that particular objective. And because of those changes, adding some mandatory, the bonus measure going to a mandatory measure for query of PDMP, um, the changes that they've made over the past couple of years for public health clinical data exchange, they have revamped their scoring methodology. So, what we're doing, or what we're seeing now, is that health information exchange, that objective, You're getting up to 30 points for the measures within that category. Provider to patient exchange, which was the patient portal measure, that is now worth 25 points, so it's not weighted as high as it has been in the past. And public health and clinical data exchange is weighted higher than what we've seen in the past. And that makes sense because now they've got some mandatory measures in that category. We, in our dashboard, are going to have the points and the reweighting set up so that as you add information into the dashboard, you'll be able to see those points. We also will hope to have some information shortly that would allow you to take a look at that scoring in our marketing material that we'll be sending out. So once again, any specific questions, this can get kind of tricky as you navigate through this category. Reach out with any questions you have.
Thank you very much, Lisa. That was very informative.
Great. You're very welcome.